great question because they're very, very different. Both need a significant amount of coaching and education. With type 1, it is much more surgical and scientific in nature, right? With type 2, it's more about, hey, eat this kind of diet, don't eat this, get this exercise. With type 1, it's life or death. To your point about carb counting and insulin, because there is a requirement of insulin in this population. And there's also, from a mental health standpoint, Brianna, also an increase, I don't want to say burden, but an increased aspect of mental health that goes along with a condition that a lot of folks get diagnosed at a young age and live with, for the rest of their lives. It's just a different lifestyle, right? So the support is definitely, individualized for folks living with type 1 diabetes. Um, CCS is very different from other distributors in that we've always had a very clinician first type of attitude towards the device distribution. So we actually have certified diabetes educators, nurses that are in the field that educate patients, which is very different, right? So our nurses are actually working with folks, and most of them are individuals with type 1 diabetes on insulin pumps as well as their continuous glucose monitors, about all the stuff that you already talked about. We also provide virtual coaching and education support as well. I will say that when I was in medical training, I hate to date myself over, 20 years ago, it was called juvenile diabetes, right? Because it was under 18 years of age, it was in children. And now what we're realizing is there are many adults that are living with type 1, just not diagnosed. And that's called late onset type 1 diabetes. And so I don't know the exact age, but I will say that we're getting better at diagnosing adults with type 1, which is probably why, in the past it was called juvenile, but now that we've gotten smarter, we know what tests to order and how to recognize it, and we're educating ER doctors to catch it, that we're going to see a higher average age for type 1 than perhaps what we thought in the past. A lot of it's so multidimensional. I would say that majority of individuals with type 1 diabetes are under the care of an endocrinologist. Primary care physicians, I'm an internist, for instance, right? And I'm a primary care physician. I got education in diabetes. I don't know that my primary care physician community would say that they're experts in managing insulin dosing, carb counting, the additional support and education that we mentioned earlier, in the ability to provide that. And that is why endocrinologists exist, right? It's not all they do, but a big portion of what an endocrinologist does day to day is manage complex type 2 and then type 1 diabetes. So most primary care physicians would say, listen, if I have someone with type 1 diabetes, I'm going to try to get them to an endocrinologist. The problem is that we have a shortage of endocrinologists in the country. Because of that, 51% of endocrinologists in a recent survey that we did, an independent survey, so that there's a 3-week visit to actually get in. 15% of endocrinologists said there's more than an 8-week wait to get in for a visit, right? So, and primary care physicians operate differently than endocrinologists because endocrinologists specialize in this. They're going to have support staff, educators, dietitians, nurses that do this every day, right? That specialize in this, that can provide the education coaching. A primary care physician office not just does diabetes, but they're always also doing back pain, headaches, congestive heart failure, kidney disease, you name it, right? All of it. And so a lot of this is driven by the shortage of endocrinologists. We also learned from the survey that primary care physicians specifically did not feel adequately trained to manage complex diabetes patients. They, 58% of primary care doctors and 85% of endocrinologists said that they just felt overwhelmed with the amount of diabetes cases, not just specific to type 1, but just in general. And both reported, almost 80% for both sides, that for both PCPs and endos, that they were having to spend more time educating and training themselves because these devices are complicated, right? There's new ones coming out, and we think of like, oh, great, innovation, this is awesome. But we forget that before it gets in the hands of patients, somebody has to prescribe it. And in order to prescribe it, they have to understand it, they have to be able to explain it. And so clinicians get overwhelmed. And we do know from the survey that 60% of PCPs and 77% of endocrinologists said that that in itself was directly leading to burnout. So you have a shortage of specialists. You have primary care physicians that are overwhelmed and don't have the necessary background to manage complex diabetes, which is what I would call type 1 diabetes, by the way. I would put that in a very different category. And they're saying that it's hard to keep up and it's causing them to be burned out.